John here and tell you a little bit more about him. Dr. John McNaught, he likes to be called John, is the founder and medical director at Fertility Ontario, a provincial leader in fertility care. In 2008, Dr. John McNaught closed a busy surgical and obstetrical practice to focus primarily on the diagnosis and treatment of infertility. And since that time, John has gained a reputation for working tirelessly on behalf of his patients. In addition to working almost every day at Fertility Ontario, John spends his spare time updating the Fertility Ontario website and answering emails from patients. Dr. John is also Dr. John McNaught. I can't help it. I'm always calling Dr. McNaught John. Is he's also a big advocate for effective fertility therapy, and he has been quoted in both the provincial and national media in support of funding for fertility treatments. In addition to advanced techniques such as in vitro fertilization, Dr. McNaught has gained a reputation as an expert in natural fertility methods. Over the last couple of years in particular, he's increasingly used vitamin antioxidant therapy to help several couples realize the dream of building a family. Tonight's webinar focuses on answering all the questions you have regarding natural fertility supplements. So without further ado, welcome John to the call.
Thanks a lot, Melissa. Thanks so much, everybody, for coming out and spending an hour of time with us. I know that everyone is leading busy, hectic lives, and I do appreciate you coming out. As Mel pointed out, I will get back to each and every one of you in terms of email feedback as I have for our previous webinars. Tonight's attendance is a little bit more than we normally average, so all I'll say with respect to the emails is give me a few days and I will do my best to get back to everybody. What I would like to talk about, something that I'm very passionate and excited about, and that is, although we're known for advanced techniques like IVF at Fertility Ontario, we get a lot of people pregnant naturally, and that's gratifying for both us and the patient. And tonight we're going to talk about how we do that. So, in the next hour or so, we're going to talk about my all-time favorite antioxidant, which is coenzyme Q10, also known as ubiquinol. We're going to talk about antioxidant treatment for both males and females and why it's so effective. And then ultimately, because some of you will be, on your own or from different parts of the province, if you're not a Fertility Ontario patient, we want to teach you what to look for in a fertility supplement. So the reason that we have such an interest in this topic is because, particularly in North America, times are changing. We're a very modern, industrialized society, and what that means for us is that we are very different than our parents and our grandparents. Our foods, our technology, and the way that we live our lives is very different than what it was 50 years ago. The reason I've included this picture here is that 100 years ago you couldn't see our cities from space, but these days we light up the sky with our cell phones, computers, laptops, all of the technology that we're constantly carrying around with us, and our cities that never seem to go to sleep. Our food is highly processed. It's very difficult to find anything good to eat in the North American diet. So all of the technology and industry that we bring to our modern lives has a profound effect on the way that our bodies function. In addition to that, we are changing the way that we build our families. We know that the average age of childbirth in North America increases every year, and the proportion of children that are born to women more than 40 years of age increases year after year. As you know from previous webinars, age is not particularly kind to people's attempts at fertility, and so we see more and more people struggle with fertility as they delay family building. So when we have a situation where people are having struggles with building a family, we need to be very careful in terms of the way that we eat, the environment that we live in, and the things that we put in our body. natural supplementation has arisen as a way of either replacing the things that we're missing in our diet or finding a way to protect us from the harmful things in either our diet or our environment. And the rise of natural supplements is very encouraging because people have a lot to choose from, but at the same time it's very confusing because everyone has an opinion of take this, take that, and as the patient or the client or the consumer or even the doctor, sometimes it can be very, very confusing. So tonight we're going to try to simplify things a little bit. One of the main things that we're going to talk about is the concept of antioxidant therapy, or relieving the damage that's caused by what we call oxidative stress. Now, I know a lot of you come into my office and ask me probably the most common question in my fertility practice, and that's, Doc, can stress play a factor? And I think what most of you are talking about is the long hours at your work, tension in your relationships, stresses about money and finances. And absolutely, those do play a biologic role in terms of the way we function, the way we heal, and the way we go about our daily activities. When we talk about oxidative stress, though, we're really talking about something else. Talking about a byproduct of the way that our cells metabolize, and a change that becomes more profound as we get older. I'm going to make an attempt here to pull up a YouTube clip that will help you understand this concept visually.
In AF, the heart works less effectively as a pump, with the result that there are areas within the heart where blood flow is slow or...
So we're going to watch a brief video on the concept of oxidative stress.
Is a powerful lipid-soluble antioxidant. Free radicals are unstable molecules with an unpaired electron. These free radicals search out cells in the body in order to take electrons from them. Once these cells have been stripped of an electron, they become damaged and unhealthy. This process is called oxidation, and it can lead to the eventual dysfunction and damage of the cells. As free radicals steal electrons from cells, the process spreads and other cells are damaged. Ubiquinol is an antioxidant. This means that ubiquinol is capable of...
Okay, thanks for bearing with that for a sec. I hope that came through okay on everybody's screen. The concept there is, Mel, are we still live?
Yes, we are.
Okay, good.
Yep.
Great. The concept there is that when our cells metabolize and we make energy, some of the byproducts of energy production are these free radicals or reactive oxygen species. As they circulate through our body, they can actually cause damage to surrounding cells. That's sometimes a natural part of the aging process because not all of the cells in our body are immortal. Some of them are supposed to die and are supposed to stop their function by natural attrition. But in some cases, particularly when we're young, we have a natural defense against reactive oxygen species or a natural defense against oxidative stress. And that's in the form of antioxidants that occur within our system. Of course, today we're talking about supplementation of antioxidants, but it's important to know, particularly in younger people, that most of these substances occur quite naturally and in great abundance within the body. Coenzyme Q10 is going to be a focus of a lot of what we're going to be talking about tonight because it's one of the most potent human antioxidants, and it's actually found in virtually every cell in the body. It's also known as ubiquinone, and as some of you know, the word ubiquitous means found everywhere. So ubiquinone is a substance that's found throughout the entire body. It's a single molecule, but it has many different roles. It provides protection against oxidative stress. It sort of soaks up free radicals and prevents them from damaging cells. It's very important in energy production. We make most of our energy in the form of something called ATP that helps the energy producing cells within our, the energy producing bundles inside our cells called mitochondria work. So in terms of our metabolism and how our cells function, ATP is sort of the energy that they use for daily function. And of course, there's also antioxidant regeneration. The naturally occurring antioxidants, vitamin E and vitamin C, actually depend on the CoQ10 pathway in order to regenerate themselves. So when you're low in CoQ10, the ability of other vitamins to function is actually diminished. And that's going to be important later on when we see how this impacts fertility therapy. The problem with our natural protection against oxidative stress is that it's not with us for our entire lives. Because oxidative stress is part of the natural aging process, levels of CoQ10 or ubiquinone tend to decline after the age of 20. And so we've talked about, the increase in maternal age in North America. People who are 38, 39, 40, 41 are increasingly becoming pregnant. The difficulty is attempts at pregnancy are being made when the body's natural protection against oxidative stress is no longer at its peak. You'll be happy to know, any of you that are proud Canadians, that some of the best research on coenzyme Q10, particularly with respect to fertility, is done by a Canadian group. So Canada is making a name for itself on a worldwide stage in terms of looking at the effects of antioxidants on human reproduction. Dr. Bob Casper of the TCART Center in Toronto is, along with a large group of basic scientists who work underneath him, studying the effects of supplementing coenzyme Q10 in aging mice. And I had the privilege to attend one of his talks where he went into his basic research. And, Dr. Casper is a colleague of mine, but somebody that I'm still in constant awe of, quite literally one of the smartest people I've ever met. And without getting too much into his research, he has demonstrated a profound change in the actual DNA of mouse eggs in response to supplementation with high doses of coenzyme Q10. It's something that, like most animal research, hasn't been proven in human studies yet. But as you can understand, it's very difficult for us to examine the DNA of human eggs without damaging them. So we're sort of beholden to the mouse model in terms of finding the answers we need to help people. And I'm 100% behind Dr. Casper in terms of his theory. He believes it improves the quality of eggs. I believe that too. I've seen it in my clinical practice, and what I'm hoping to do tonight is show you how it works. An important thing to understand about coenzyme Q10, particularly if you're a consumer, in a situation where you're going to see this on the shelves of grocery stores, pharmacies, I bet you it'll be in convenience stores eventually, is that there's lots of different types of coenzyme Q10. The more common type that you're going to come across is ubiquinone, which is the oxidized form of coenzyme Q10. After it is involved in the metabolism of ATP, it becomes a reduced form, ubiquinol, which is a much, much, much more potent antioxidant than ubiquinone, and is more potent in terms of its ability to protect your cells against free radical damage. Ubiquinol, the active form, is found in several different organ systems throughout the body, predominantly the heart, the kidney, and the liver. It's also found in reproductive organs such as the testicle. What's interesting is that when you actually replace it back into the system, when you supplement coenzyme Q10, the areas where it's taken up the most are the adrenal glands, also known as our stress organs, and the ovary. We can see here that as you get older, the concentration of ubiquinol drops pretty rapidly. So similar to the drop in ovarian production that we see in the mid-30s, we also see a very close parallel in the drop in our body's ability to buffer oxidative stress. I can tell you this is not a coincidence. This is the exact sort of velocity that we see in terms of decreasing ovarian function, and at the precise point that we see it in older women. So it's very reasonable to theorize that our body's ability to protect our cells against oxidative stress goes hand in hand with a drop in ovarian function that's associated with aging. In terms of the antioxidant that we are most excited about for 2012 and 2013, some of my patients are now on ubiquinol, 50 milligrams, which if you compared it to CoQ10 would seem like a much smaller dose than what I had previously had people on. I was using 400 and 600 milligrams of ubiquinone, which is the more oxidized form of CoQ10. Because ubiquinol is more potent and more biologically active, the 50 milligrams 2 times or 3 times a day is actually equivalent to a massive amount of coenzyme Q10. So patients who are taking 50 milligrams twice a day are taking more coenzyme Q10 than the patients for whom I prescribed 400 milligrams of the more oxidized and less potent form. So ubiquinol is a way of getting a lot more antioxidant into your system at a much smaller volume. Ubiquinone is produced pretty much everywhere in the system, and as I said, our cells need it in order to produce energy. If you don't have ubiquinone, your cells can't function. And before it can be used, it needs to be converted into ubiquinol. So when we look at something like Vital Q, we've already got the pre-converted body ready that's going to have the most antioxidant protection. So the advantages of ubiquinol and why I'm so excited about it are the fact that it has a better absorption, higher concentrations, and as my patients will tell you, it's a lot easier to take. We previously used a vitamin supplement out of San Diego that called for up to 4 to 6 capsules taken a day. They were very bulky. They caused a lot of gut rot, and patients took them because they contained grapeseed extract, which is a very natural form of coenzyme Q10. Unfortunately, you needed to take a lot of these bulky pills throughout the day in order to get the doses of CoQ10 that I was looking for. Since we've started using ubiquinol, we found that patients can take 2 small capsules twice a day and get a more potent antioxidant effect. So it's really a situation where everyone's a winner. Antioxidant therapy is not just for women. We spend a lot of time talking about the ovaries and the eggs contained within them, but sperm cells are equally, if not more, susceptible to oxidative damage. And coenzyme Q10 is a major component of all of the vitamin supplements that I use in men. And I'm not ashamed to admit that when I got my wife pregnant with our second child, I was using antioxidant treatment with coenzyme Q10. And our time to conception was a lot quicker than with our previous child. So part of my passionate belief in this particular therapy is through my own experience. Again, this is Canadian data on antioxidants and male fertility, and Canadian scientists have been very active in terms of examining this field. What they found is that prior to even interactions with a fertility specialist, approximately 30% of men were already taking something natural to try to increase their fertility. The basis of antioxidant therapy when you're looking at male sperm cells is that men who have high levels of oxidative stress tend to have lower levels of pregnancy in their female partner. Oxidative stress is associated with sperm dysfunction and DNA damage, and it's also been shown to have increased dysfunction in vitro. So when we're looking at sperm cells under a microscope in the laboratory, high levels of oxidative stress lead to sperm that don't swim as well. Sperm are very small cells, so they have a limited capacity to neutralize oxidative stress. Because they're such a small cell volume, they don't have a lot of capacity for native antioxidants. And of course, some men will have a semen antioxidant deficiency, and that's where the role of supplementation comes in. And again, this is, as I mentioned, a study showing that men with a history of infertility tend to have higher levels than average of oxidative stress within their semen. Conversely, men who have high levels of oxidative stress tend to have lower rates of natural pregnancy. So there's a very, very strong correlation. And the concept is, if we can reduce the levels of oxidative stress through antioxidant therapy, we can increase the probability that these men will get their partners pregnant. And even scientists agree. I don't know if you're familiar with the Cochrane collaboration, but it is essentially the Bible of evidence-based medicine. It looks at all of the available studies in the medical literature and seeks to find consensus. When they reviewed the topic of antioxidant therapy in males, they found that it was associated with a statistically significantly increased pregnancy rate compared to a placebo. And the Cochrane collaboration is one of the highest levels of medical evidence available. This is, not snake oil. This stuff really works. So we've spent a lot of time talking about ubiquinol, and I'm 100% convinced that it is the best antioxidant available, but it's not the only one. And I currently recommend that my patients take it along with a more comprehensive vitamin supplement. So what I'd like to do for the remainder of our talk is look at some of the other vitamins and antioxidants that are going to be available to you. Look
John,
at their various,
we just had a question come in. Sorry to cut you off there.
Sure. That's okay.
We have a question in from Kathy, and she's wondering, can oxidative stress contribute to anti-sperm antibodies?
Anti-sperm antibodies are relatively rare. There's usually some sort of physical breach in the barrier between the vas deferens and the rest of the bloodstream. The body's ability to protect itself against damage caused by anti-sperm antibodies might be improved through the use of antioxidants, but we don't know enough about it yet. Because it's a relatively rare phenomena that we see in, guys who have testicular injury or men who have gone through vasectomy reversal, I don't have enough data right now to comment on whether or not antioxidant therapy can improve that. What I can say is that guys with anti-sperm antibodies don't tend to have a complete absence of moving sperm. The antibodies will bind some of the sperm, but not all, and antioxidants would play a huge role in terms of improving the motility of the unbound sperm.
Wonderful. Thanks for answering that. And if you have any other questions, feel free to ask them. I had a few questions come up actually that maybe are on some other people's minds. Is there a way to measure how much coenzyme Q10 our bodies are currently producing? Is that a measurement that there's a way to know?
Not practically. It has been done. It's something that basic scientists have done and looked at the rates of ubiquinol and ubiquinone in various subjects and in various disease states. So yes, it can be done. Can it be done at my office or at your local laboratory? No.
Okay.
It's just impractical. And I think if you look at the relative ease and low cost of antioxidant supplementation, if you're having difficulty or if you're struggling with fertility, rather than figuring out what your ubiquinone levels are, it would make more sense to just get on a decent supplement.
Got it. Awesome. Thanks. And I had another question too that kind of came across my mind here. If people start Googling, coenzyme Q10 or ubiquinol, if they start Googling these terms, they're probably going to get a ton of stuff coming up. When it comes to actually seeking out something like this product, is there and you might not have an answer to this, but is there just a lot of stuff on the market that doesn't really suit what people would be needing?
I think people should be relatively choosy in terms of something that they're going to spend their time and their money on. I think
Oh, John, we might have lost you. Are you still there by chance? Can everybody hear me okay? Just you can send me a little question or you can type in the message box. I just want to make sure that we might have lost John for whatever reason. So if you have...
and that we're very comfortable. I'm sorry.
Oh, sorry, John. You know what? You just cut out for me for a strange, for a second.
No.
But you're back for me.
Okay.
And apparently people are saying that they can hear you. So maybe it was just my computer.
Okay.
Sorry about that.
Anyway, I'm not going to endorse a specific product today. What I'd like to do is look at the available ingredients. But if people are wondering, you can send me an email and I can send you some links to some supplements that I use with great effectiveness and are also monitored by Health Canada, so you can be assured of their content and their purity. I think it's important to choose a good supplement because there's tremendous upside, there's tremendous value, but you need to get something that's quality.
Wonderful. Thanks.
Okay, so we're going to move along here. I want to get into a concept that I described to a colleague a couple of years ago as the new prenatal vitamin. We were talking about vitamin therapy, and I said, realistically, the prenatal vitamin that people take isn't enough. It is essentially, boosting your iron stores, boosting your folate stores in anticipation of getting pregnant. But the problem with the prenatal vitamin is that it assumes that people will get pregnant easily. For people who are struggling to conceive, the traditional prenatal vitamin is not enough. So absolutely, you need iron, you need folic acid, but when choosing a vitamin supplement, I want you to consider some other ingredients that I feel are important. Magnesium is something that I am very interested in terms of its properties with respect to fertility. As most of you know, it helps maintain normal muscle and nerve function. It's important in keeping the heart rhythm steady. and it's good for the immune system. When I think about magnesium, I think back to my days as an obstetrician, where we used it as a medical therapy on the labor floor. And although we were using it for a different reason, we found that because it's a natural muscle relaxant, when we administered magnesium, it tended to ease uterine contractions. We also know that it's been known as a natural remedy for menstrual cramps. I think that the quiet uterus is probably more susceptible to embryo implantation, and I think magnesium plays a role in easing subtle uterine contractions that might impair embryo implantation. The only problem with that is that at this stage, that's just a wild theory that I have in my head. I am looking at a scientific project to prove that some way, but certainly there are a lot of people with the North American diet who are deficient in magnesium. A little bit of supplementation, either through diet or a vitamin therapy, will tend to go a long way. Zinc is also something that is frequently a part of both male and female fertility supplements. It's very active in terms of the enzymes that promote metabolism. It plays a role in immune function, protein synthesis, DNA synthesis, and cell division. And as I'm sure you can understand, those last two are extremely important in both male and female fertility. It also supports normal growth and development during pregnancy, during childhood, and during early adolescence. It's not something that your body has a great capacity to store, so finding foods that are high in zinc is important. What I've put a picture of is not something that a lot of preconceptual women are advised to eat in great amounts, but oysters are the food that have the highest natural levels of zinc available. Other red meats and poultry will have high levels of zinc as well. Particularly if you're a vegan or a vegetarian, finding either a dietary or natural supplement of zinc is going to be very important. B6 and B12, two of the major B vitamins, are very important in terms of nervous system functioning and the production of blood cells and DNA. And B6, although not proven, there have been several case studies that suggest that vitamin B6 may help with progesterone metabolism and strengthen the luteal phase that occurs after ovulation. So again, it comes back to a lot of these theories are not absolutely scientifically proven, but B6 and B12 have so many other health-promoting functions in the body that being deficient in them doesn't make sense in any situation. Vitamin C and vitamin E are two naturally occurring antioxidant vitamins that have been shown to improve sperm quality, and so they'll frequently be found in high-quality male fertility supplements. And interestingly, they're natural antioxidants that work together with coenzyme Q10. So if you can improve the level of coenzyme Q10 in your system, vitamin C and vitamin E work better. So it all gets back to CoQ10, our basic, most ubiquitous antioxidant. When you get that system working well, your other antioxidant systems will work even better. L-arginine is an amino acid that promotes blood flow to the uterus, the ovaries, and the testicles. And it has benefits in both males and females. And in the female, similar to magnesium, it aids in creating a healthy environment in the uterus for embryo implantation. It's kind of a natural vasodilator. If you look at some of the things that are very negative in terms of fertility promotion, like cigarette smoke or excess levels of caffeine, L-arginine is sort of the opposite effect. It improves blood flow. Obviously, still stopping smoking and cutting down on caffeine are important, but L-arginine can help to counter some of the effect of vasoconstrictors. Lycopene is a natural antioxidant that is also been shown to improve sperm motility. and male fertility supplements that contain both lycopene and coenzyme Q10 probably provide the greatest antioxidant effect. So although a lot of our guys will be on vitamin supplements that contain coenzyme Q10, the ones that also contain lycopene provide an added advantage. And beta carotene is one of the natural vitamin A supplements. It's very important for testicular sperm production. Whereas the other components tend to improve motility, vitamin A seems to be directly related to the production of sperm, which often takes several months. So long-term supplementation is important. Okay, so we just went through a rapid laundry list of available fertility vitamins and supplements. And most of you are probably staring at your computer saying, what is this guy talking about? He just rattled off 12 different supplements, didn't tell me which ones to take, didn't tell me how much to take, and didn't tell me where I could find them. How is this supposed to be helpful to me? The take-home point is, don't worry. The best approach to this particular issue is a healthy lifestyle and a balanced diet. If you're a cigarette smoker, if you're overweight, if you drink mega doses of caffeine, I don't have a supplement that can overcome an unhealthy lifestyle. You need to have realistic expectations about supplement use. You need to know how many times a day you can take them. They need to work into your work schedule and your lifestyle, and they have to be affordable and easy to take. If you do have questions, one of the best types of people to talk to is a naturopathic doctor or a more traditional doctor who has experience with antioxidant treatment. Again, I think we need to focus very heavily on coenzyme Q10. If you have to pick one vitamin or one supplement, that's an excellent place to start. But what I would caution people is don't stop there. Improve your overall diet, supplement where necessary, and you'll get your best opportunity at natural pregnancy.
We have a question in. This came in from Laura, and this came in probably about 20 minutes ago. It was just about, you brought up briefly there, John, you brought up cost, right? So to ensure that
Yep.
you fit into people's lifestyle. What does a ubiquinol or coenzyme Q10 supplement cost in terms of a range for people, just to give them a bit of an idea?
Well, for most people, what I recommend is a very basic fertility supplement, something that contains vitamin C, zinc, magnesium, and those are a relatively low-cost supplement. A month's supply is going to run in the $40 to $50 range. You do want to get something that's reasonably high quality. So, although you can get a prenatal vitamin at the drugstore for relatively cheap, when you're talking about preconceptual nutrients, it does make sense to spend a little bit more money in order to get quality, but you shouldn't be spending hundreds of dollars per month on vitamin supplements. If we look at something that's a little bit more potent and that we reserve for more challenging cases like Vital Q, in our clinic it runs about $85 a bottle. Don't quote me on that, I would have to check with my staff. But that's going to last people for about 6 weeks at 2 tablets a day. And in comparison to some of our more traditional fertility therapies, that is very inexpensive. If you compare it to the cost of fertility medications or fertility enhancing procedures, using vitamins and antioxidants as a first step can save you a lot of money and aggravation.
Awesome. Thanks for answering that. We have a question in from Sarah. Sarah's mentioning that acupuncturists are suggesting royal jelly, and she's wondering if you know if there's any benefits to that.
Royal jelly is, it's kind of in the, it's kind of in the category along with, you know, maca root and chasteberry, where I don't really have a lot of familiarity with it. You know, whereas I can look at the supplements and vitamins that I've mentioned, and I can kind of break down for you their mechanism of action. When I look at something like royal jelly, it doesn't really make a tremendous amount of sense to me, and there is a paucity of evidence surrounding it. So, you know, when I'm making my recommendations in terms of the supplements that I am confident in and which I know work, it's just not, it's not on the list.
Awesome. Thanks for answering that. We have some more questions kind of popping in here. Christina actually has two questions, so I'll kind of lump them into one here. She's wondering, I know you brought up earlier the total fertility for women from Coast to Coast Science. Is it a good
Yep.
supplement, and does it have enough coenzyme Q10 in it? And then she's also wondering, I'll just kind of throw this in there. She's wondering if you need a script for Vital Q, and can you buy it at a drugstore?
So, you know, we'll briefly just touch on total fertility. That is you know, a preconceptual vitamin that is made out of San Diego and that we have previously distributed out of our clinic, and we've had a lot of success with it. And you know, I could you know, quite literally regale you for hours with the you know, miracle pregnancies that have come from total fertility. In 2013, we're not going to be carrying that particular product anymore, and it's because it doesn't have a natural health product number by Health Canada, and because we can't vouch for it at the level of Health Canada, even though we've had tremendous success with it, we've decided to go with Canadian products instead. And what I can tell you is that when we move to the Canadian products, the quality available is going to be even higher than what we were getting from Total Fertility. So the switch I see as a step forward and not a step back, and it's also going to be easier to take for people and less costly. In terms of Vital Q, it is available at Fertility Ontario. It is available through, I believe it's yadtech.com. It can be ordered online, and I believe on their website they have a list of available pharmacies that carry them. Anyone in the London area, we can get it into your hands, particularly if you're older or you have a low AMH level. I would highly recommend being on a high potency antioxidant like Vital Q.
Awesome, thanks. We have a question in from Ashley. She's wondering if you would recommend, since we're talking kind of over-the-counter items, she's wondering if you would recommend an over-the-counter prenatal vitamin. I'm assuming prenatal vitamin, yeah.
Yeah, you know, realistically, they're all very similar. You look at Materna and its generic equivalents, and they're very suitable. A lot of my patients, I will recommend them to have a daily total of 1 milligram of folic acid as opposed to the 0.4 that's found in most traditional prenatal vitamins. That's because a lot of my patients are a little bit older, and you know, sometimes they come into conception with a little bit more risk attributed to them. Anyone that you can find that has a milligram of folic acid is going to be more than suitable. For people who are trying to conceive, I would really encourage you to look at some of those other elements that I talked about. They're probably not present in your typical prenatal vitamin, and finding a supplement that contains them is going to be part of your path to success.
Awesome, thanks. So this question is coming in from Sarah, and she's saying, what's the name of the Canadian multivitamin that is replacing Total Fertility? And she's wondering if it's available in regular drugstores.
The product that we are going to be going with, and you know, I wanted to stay away from endorsing particular products, but we're going to be going with the line called Fertile Pro out of Montreal. It is available at yadtech.com. It will be available in select pharmacies. some naturopathic clinics, and some health food stores. In Ontario, it'll be available at select fertility clinics around the province. We carry Vital Q now. We carry Fertile Pro for men, and shortly we're going to be carrying Fertile Pro for women as well. So, I think at baseline, most couples trying to conceive would do very well with being on a basic fertility supplement like Fertile Pro. And in people who are older or people who have lower ovarian reserve, the addition of Vital Q is going to make for a complete response.
Awesome. 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 We have great questions, everybody. If there's any more, keep asking them away. I have another question here for you, John, from Christina. She's wondering, does coenzyme Q10 help with the embryo fragmentation? Help with embryo fragmentation?
Anecdotally, yes. All I can tell you is I've taken people who have, grade 3, grade 4 embryos that have a high degree of fragmentation, put them on Vital Q, and they get grade 1, grade 2 embryos. But you have to appreciate that I'm talking personal experience. I'm going to be biased in my mind to remember the good outcomes and disregard the bad. So in terms of, hard scientific evidence, we don't have it yet. I believe it's going to be coming, but most people are very reticent to be involved in any research that involves coenzyme Q10 because it holds so much promise, because the potential benefit is so huge. No one wants to be part of the placebo group in a scientific study. So, it's going to be a tremendous challenge to get really good scientific answers. I think the basic science makes a lot of sense. We know it is, the benefit is tremendous and the risk is very little. So I'm going to be in that camp that says, why wouldn't you supplement with coenzyme Q10?
We have a question in from Terry. She's wondering, in your opinion, what do you think are the most important supplements to take in addition with prenatal vitamins if you still have a high AMH level?
With people with normal ovarian reserve, I think being on a small amount of coenzyme Q10 is fine, like something in 100 milligrams to 200 milligrams, because there is a benefit. I think it's important to have both partners on vitamin therapy because we certainly know that, it's not all female infertility. If your husband was exceptionally fertile, he would get you pregnant no matter what your baseline fertility was. So treating both partners is important. For women, I think magnesium and zinc are very important, vitamin B6 and vitamin B12. And then for men, l-arginine, lycopene, vitamin E, vitamin C, and zinc. So a lot of the ones that I mentioned in our slides, those are the ones that I would focus on in terms of choosing supplements.
We have a question in from Laura here. She's wondering if her husband can take Fertile Pro when he's taking a multivitamin already.
Yeah, I think there's going to be no downside to that whatsoever other than, nobody likes taking a lot of pills per day. One of the things that I like about Fertile Pro is that my patients are going to have to take less capsules in a day than the people who were taking our natural supplement out of San Diego. So previously, those male patients were requiring up to 6 capsules a day of the San Diego supplement. Using the Fertile Pro, they're only going to require a couple of doses a day. So it's going to be a lot easier to take, and if you want to keep with your standard vitamin regimen, it'll work in no problem.
I have another question in here. This is from Melanie. This is a great question. She's wondering if Fertile Pro Women is a supplement that you can continue to take once you achieve pregnancy, or is it something that once you're pregnant you just stop taking?
You can absolutely continue to take it because it has elements in there that, like the folic acid, which are going to be important for ongoing pregnancy. However, it's not going to be necessary. So if you find that it's in short supply or difficult to get, you could switch over to more traditional prenatal vitamin, no problem at all.
We have a question in from Sandria. Um, she's wondering, when should you start taking Fertile Pro? And she means how long should we try to conceive naturally before taking these supplements?
Yeah, so I think if you look at the cost of a supplement like Fertile Pro, it makes a lot of sense to start taking it right away. I obviously have a bias there, but I think a lot of people who have struggled with fertility know how it feels and know how each passing month the pressure just gets higher and higher. So if you can set yourself up for success right away, the worst that you're going to do is get pregnant more quickly than you thought you would. There's a lot of non-fertility health benefits of the vitamin supplements that we've been talking about, and I think it's part of healthy, balanced living. So I would say start right away. In terms of when they take effect, it could be as much as 3 months before you see full effect. But I do find that as much as 4 to 6 weeks, I'm starting to see qualitative changes in both men and women. So the sooner you start, the sooner you're going to start to see some effect.
Awesome. I have a question in here from Melanie. She's wondering, is age a factor when deciding if Fertile Pro is necessary? She's 33 and her husband's 40, and they're wondering if it would be beneficial for both of them.
Yeah, I think that, it would definitely be beneficial to both parties. Age is a little bit more forgiving to men than it is to women. Um, to somebody like Melanie at age 33, what I would recommend is get an AMH level done. That is a marker of your fertility potential that is available at several fertility clinics across the province. I used to draw AMH levels only on people who are older, greater than 35. Now I draw AMH levels on all my new fertility patients, and I'm finding that we're seeing decreased ovarian function in people who are even less than 30 years old. So if you really want to know what your fertility potential is and what you need to do, go to a doctor, get some counseling, get some testing. If you don't know, you're not going to be able to help yourself, and the sooner you get the answers you need, the better.
This question is coming from Misty, and she's saying she's wondering, is it worthwhile to take total fertility or Fertile Pro for women, even if you've already done an IUI procedure and are in 2 weeks of waiting to find out if you are pregnant?
Well, I look at things like vitamin B6, which is present in a couple of those supplements, and it does seem to improve the ability of the corpus luteum, which is the remnant of ovulation, to effectively synthesize progesterone, support that uterine lining. Again, it's not a very scientific answer, but I'll go back to why wouldn't you do that, right? People who are up against it in terms of fertility therapy, I think, anytime you can do something simple that's going to increase your odds, that's something that makes sense to do.
Wonderful. We have a question in here from Christina. She's wondering what AMH stands for.
Oh yeah, AMH is anti-Müllerian hormone, or it's Müllerian, not Müllerian. And AMH is made by healthy follicles within the ovary. So the more of it that you have, the higher the levels of AMH there are, like the more healthy follicles there are. So it's a blood marker of what we call your ovarian reserve. We sometimes refer to it as your fertility potential. For me, and I think we talked about this a little bit during the aging and reproduction seminar or webinar that we did, AMH has been a game changer. If I had my way, every couple trying to conceive in Ontario would have an AMH level done. And I know a lot of my colleagues across the province feel similarly about it. It really improves our ability to predict who's going to need our help and what their prognosis is. AMH testing is available at Fertility Ontario. In Mississauga, it's available at ISIS Regional Fertility. and in Toronto, it's available at Create Fertility. So there's several clinics across the province that can do the testing for you.
Wonderful. Wonderful. We have another question here. It's from, I'm going to say this, Zenab. I'm sorry if I say that wrong. She's wondering what's the difference between Fertile Pro MTL and Fertile Pro?
Now, people, I don't work for this company, so
maybe
I,
people are Googling, wondering what one's right for them.
I am not a Yad Tech salesperson. So the difference, as I understand, is I believe the Fertile Pro LQ has l-arginine, and it has a slightly higher amount of coenzyme Q10. You know, Fertile Pro LQ is more for older women or women with decreased ovarian reserve. So if I was, using it for that purpose, I would pair it with Vital Q at the same time. And as such, when you're using Vital Q, the amount of coenzyme Q10 in your other supplements doesn't really matter because it's going to give you a maximum amount of antioxidant effect.
Awesome. We have some more questions here. Thank you, everybody, for asking these questions because it's a really cool topic. Ashley's wondering if there's any harm to taking too many supplements.
I think, there have been cases with some herbal supplements where they can have a damaging effect on your liver. The things that I've been talking about today, as long as they're not taken in mega doses, are nothing but benefit. Really high doses of certain vitamins, like vitamin C and like vitamin E, haven't shown to have a detrimental effect. And there isn't really much value to mega doses of vitamins. So you want to just sort of take everything in moderation, and generally at the prescribed dose. A lot of research has gone into these supplements in terms of dosing and potency, and taking more than what is suggested on the bottle is generally not to your benefit.
Awesome. We have a couple more questions here. Terry's wondering, she apologizes if this was already answered, and I can't remember, but she's wondering if it's okay to take Fertile Pro for women while you're taking prenatal vitamins.
Yeah, absolutely. They work very well together. Fertile Pro for women is going to give you most of what you need in an antenatal or prenatal vitamin. It's got an appropriate amount of, that over the total daily dose, you're going to get your milligram of folate. I'd have to check the iron content of it, which tends to be important antenatally. But if you eat an iron fortified diet and you're not anemic, it would be very suitable as a prenatal vitamin. It also goes quite easily with a more traditional prenatal like Materna.
Cool, wonderful. Another question here from Misty. She's wondering if there are any of the already mentioned supplements that you would recommend specifically for implantation.
Specifically for implantation, I mean, the one that intrigues me is magnesium, and I believe that's found in one of the Yatech female supplements. I think, magnesium, if you look at its effect on uterine muscle and, a little bit as a vasodilator as well. A quiet uterus and a uterus with lots of blood flow portends to good implantation. That's where I'm very intrigued by magnesium as a fertility supplement. So if I had to choose one, I would look at magnesium. L-arginine also as a vasodilator is probably going to be nothing but benefit in terms of implantation.
Awesome. And we have another question here from Christina. She's wondering, I think this was referring back to your AMH question about if it determines egg quality as well. And sorry, Christina, for not jumping in there. That got lost in my list of questions here. But I think that's what it's referring to, if that test can determine egg quality as well.
Yeah, so what I'm going to tell you, Christina, is what I tell all my patients, and that is that the 2012 answer is that AMH determines ovarian quantity or the quantity of the available follicles. Presently, the data suggests that it doesn't determine quality. My suspicion is that there is a qualitative component as well, but it's not something that has been well researched. So that's the 2012 answer. Come see me in a year and I'll give you the 2013 answer.
It's neat to see how things are progressing so quickly. It's a great sign for people.
Yeah, it's, there's a very old saying that all that I really know for certain is that I know nothing. Our industry is constantly changing and I just try to keep pace.
If there's anything still on your mind that is unanswered, John, I'm pretty sure you're open to people emailing you directly, right?
Oh yeah, absolutely.
Wonderful. Okay, if there's anything unanswered, I believe the email for John is actually attached to this webinar. So email any other questions that you have. And thank you for joining us. And John, I'll let you do kind of final thank yous for everybody.
Yeah, I just, again, for all the, like, this has been our most well-attended webinar by far. I realize that I talked a lot over the past 60 minutes. Thank you for paying attention. Thanks for the very informative questions. They challenged me to think in a different way, and I really appreciate that. If you're going down the road of natural fertility, please look on our website, fertilityontario.com. I've got a short ebook called Baby Steps that talks about my philosophy around getting pregnant naturally. For those of you who are still on your journey, best of luck to you. There are lots of people around you who know what you're going through and are supportive of you. Don't lose hope, because there is always something available to you. And when you get there, it's worth it. So, by all means, keep slugging. Anyway, guys, thanks so much. I really appreciated this. I had a tremendous time, and I can't wait for the next webinar.